There we go.
I think I should have been first because the space of Retzius or retroperitoneal is the one we've been using for ages. Those are my disclosure. For that talk, I guess I have a conflict with Boston, not conflict with Boston, but I did the thing for Boston Scientific and Coloplast, so for both company. And I'll try to review with you the anatomy, but I think my friend Hossein just did it for me, and talk about the pitfall of the retroperitoneal space. And basically, when you start to do implant, the reservoir is always the most difficult part. It's probably the most stressful part for the surgeon as well. And when you do it in this space of Retzius, actually it's a blind implantation, so you have to be very knowledgeable about the anatomy to don't get into trouble. If you do a second incision, as has been shown, that's easy because it's also a direct vision usually. And if you do an infrapubic, that's even easier because at that moment you actually see the directly compared to if you go with it's a scrotal approach and you do it blindly. But as Dr. Siddiqui mentioned, you can be very close to the bladder, you can be very close to blood vessels, so you have to be very careful how you angle your Caesar. And obviously, you empty the bladder before, and to help you, you can actually put the patient a little bit in trandelimbo. The ectopic placement is not without risk of complication as well. And in terms of complication, I think the reservoir is the one that gave most of the trouble. The advantage of the space of Retzius, you can use the smaller reservoir instead of the bigger reservoir from both companies, so it's even easier to put. When you do it, you can use either a nasal speculum, a Caesar, and then you enter the retropubic space in front of the bladder. And in most cases, you'll be doing fine because most of the patients we see are virgin cases, hopefully. So, however, you may have a complication. Bladder perforation, you can have, as Dr. Siddiqui mentioned, compression of an external iliac vessel, small bowel obstruction, and even there's complication of erosion into the ileal conduit has been reported. You saw the rectal injury. So you have to be aware of the anatomy so you don't get into trouble. Gotcha. But when you look at the rate of complication, ectopic versus the retroperitoneal, actually you get more complication when you use an alternative placement for the reservoir. And if you look at all the data available, you'll see that if you're really in the good space of Retzius, you had less risk of complication with the reservoir overall. But you need to be aware of the patient that might be difficult. For me, the most difficult patient is probably the one who had hernia raphe before with meshes. Those are so solid and so difficult that you will need probably an alternative placement. So for my 5 minutes, I wanted to review with you the anatomy and be aware of the challenges when you put the reservoir in this space of Retzius, and you have to be familiar with the alternative placement if you're not able to put it. Thank you.